Hello, I'm Holly Tanner with the Herman and Wallace Pelvic Rehab Institute, and I'm here with Rachna Mehta, who is going to tell us about her course in acupressure. Rachna, will you tell us a little bit about your background, please?
Thank you, Holly, and thank you so much for chatting with me about my course. I'm really happy to talk about it. I graduated from Columbia University and started working with an outpatient hospital based clinic and got interested in pelvic health. There was a pelvic floor program there, and the therapist there encouraged me to take pelvic floor level one with Herman and Wallace. And my first course was with Holly Herman, and fascinating, totally fascinating. And then the next course was with Kathy Wallace. So that started my journey into pelvic health, and I continued to specialize in orthopedics and in pelvic health. So I'd like to say I'm a Herman and Wallace trained practitioner over the years. This has been such a great institute for me to continue my public health education, but also share my knowledge with my peers. So that was one of the reasons why I brought this course back to Herman and Wallace to share, all the knowledge that I had gained through acupressure. But so really, one of the main reasons I got into acupressure was because of my complex orthopedic patients, people who were struggling with chronic pelvic pain. And a lot of my patients were doing, complementary and alternative holistic modalities like acupuncture and yoga, and that got me interested because as they were going through those programs along with therapy, the question they'd always ask and that came back to me was, what can they do themselves? So I started looking into acupressure, and I found there was such a big, knowledge base in that, but the information was really scattered. It was all over the place. Like if I, found a study that talked about a few points, I didn't know where the points were located, what they were good for, where I could use them, and how I could integrate them into my clinical practice. So I think as I started to piece the information together, I found that it was just so valuable to bring it all together, and that was really the conception of this course, and that's what I am bringing back to Herman Wallace.
Well, can you tell us a little bit about how the course is structured? What can folks expect to learn?
Absolutely. So the course is a 2-day course. We have about an hour and a half of pre-recorded lectures that go over the history of acupuncture because acupressure draws from that. It's a form of acupuncture. And we talk a little bit about traditional Chinese medicine concepts, getting our basics down, talking about the meridian channels, talking about the yin and yang forms and how the meridians and acupoints are located on the body, talking about terminology. And then from there, we delve into the scientific base. We turn on our, evidence-based perspectives, and we look at all the evidence for acupuncture. We dive into evidence for acupressure, and then from there, we also go into, how to read a chart. What are the abbreviations? What are the, we have 12 main meridians that we look at. And out of those, there are 4 that we focus more on for pelvic health. There is the bladder meridian, the kidney, the stomach, and the spleen meridian. And those have the most points that we focus on. But there are also other potent points all over the body that help and stimulate the nervous system and tap into the peripheral nervous system to heal and improve the physiological functioning of the organs, basically. So we go into a lot of that. And then from there, we talk about the fascial and connective tissue network and how acupoints are located along fascial planes. What are the connections of the fascia with the peripheral nervous system, and how acupoints have, high electrical, for example, they have high electrical conductivity on the surface of the skin. There are instruments that can measure that. So how does that tap into the central nervous system, and how there are internal branches and connections to the different organs that can help to heal and cause, physiological well-being and cause neurophysiological quieting, and it can treat so many different conditions like anxiety, for example, like incontinence, constipation, dysmenorrhea, a host of pelvic health conditions. So one point is good for so many different things. And I think that's the way I structured the course, to go through each meridian at a time. So day 1 is all diving into the meridians, but there are tons of charts in the course material. So they go over the main potent points in each meridian and anatomical locations, the TCM or traditional Chinese medicine indications, what are they used for, and then where to use them, how to use them. And then we also have a lot of labs incorporated where we go into mapping those points, and that all of the labs are in day two. And then the second half of day two, we dive into yin yoga, which is also another complementary practice to acupressure. So yin yoga is a very, very beautiful form of yoga. It's a quite meditative form of yoga. And it connects the acupressure points or the acupuncture points by putting the body in specific poses that stress those tension lines around the meridian planes. So it is a mindful way of putting the body and supporting the body with props. We use a lot of props in it. But it's also a meditative state in which we stay in each pose for about 3 to 5 minutes and we become still. So the main principles of yin yoga is we arrive in the pose. We get into the pose and basically we are meeting our body where it is. So it's also a lot of acceptance that we teach and mindfulness in that. And then it's about arriving at a point where you can stay for time. So a lot of times when students try this, they are in pain. So that's one of the things to teach them is to back off and respect pain and meet your body where it is, because you're going to be in a pose for 3 to 5 minutes. For beginners, we start at about 1 to 3 minutes, but it's always about staying, and then the third premise is being still. So stillness is something a lot of people have a hard time doing, be it stillness of mind or be it stillness of body. So yin poses definitely, help us to kind of ground and be still. But at the same time, we're also tensioning all the acupressure points along specific meridians. So we have about 4 labs built into the course. The first lab is all about mapping the acupressure points. We have about almost close to 50 points that we map. And we use stickers to map them, and they're bilateral on both sides of the body. And we also go through the chart. So you can see one of the charts in the background. The chart is by Michael Gog. So he's one of the teachers I trained with. And it's a beautiful chart, very easy to follow. And what it really is, it shows where the points are on the body, and it also shows the connections of the meridians with each other. So, for example, there's a central channel, but along the central channel, there are some powerful points. The kidney meridian flows, almost parallel to it, and so does the stomach meridian. So those points are interconnected, and there are a lot of points on the pelvis itself, both anteriorly and posteriorly. A lot of points on the sacrum, and the sacral points, a lot of bladder meridian points. So it's interesting. We go through all these meridians and points, and then we go through the conditions. And then we also have a lot of here included, including diagnosis charts. So we go by a diagnosis, which are the main important points to use for that, and then where are they located. So it's easy for people to follow that. And then other than that, we also have a whole master list of points. All the points that we teach in the course are in that master list, again, by TCM indications, by the evidence, what the evidence is on that, and then by anatomical locations. And then the labs, we have handouts for the labs that go into each pose, what position to use, how to prop. So as we go through the courses, a lot of times questions come up on what if I have a patient who has back pain or who has knee pain? How can I modify that pose? How can I support them? So we go through a lot of modifications for patients. What if someone can't sit on the floor? So then we can use a chair as a prop, or we can use a physio ball as a prop. So we get very creative with the lab portions depending on what the participants, what questions they bring to us. But also a lot of time people have had, patients who are or participants who are pregnant who are taking the course, so then I can modify the poses for them. Or once I had someone who had a spinal surgery and they couldn't do some of the poses. So we always modify, and that's exactly what we're doing in the clinic for our patients, because not everyone can do everything. And yet we bring mindfulness into the poses, and we can still stress the acupressure points along those meridian planes by mindfully putting our body in those poses.
And what kind of feedback are you getting, not only from the participants who take the course, but from the patients who receive this care in the clinic?
Good feedback. I absolutely, yeah, wonderful feedback, I'd say. Especially, and this is for anxiety. So a lot of times I start with a lot of my patients with the anxiety regimen. So I have two different handouts in the course. One's an anxiety program and one's a whole wellness program. So, anybody who's coming to us, I feel has some level of anxiety, either because they're in pain or there is some disturbance in whatever they're seeking help, from us for. So it's very helpful for them to, and for bladder spasms, like a patient right now who could not sleep well at night. So she had insomnia and she had anxiety, and that was causing more urgency and frequency in bladder spasms. So when I taught her the acupressure anxiety regimen, I taught her the points that she could use herself, for self-care during the day and at night. Within a few visits, you see a change, a big change them. And from post participants, I've had feedback. Like one person said they had a patient who was in a motor vehicle accident, and she was coming for neck pain, but her anxiety was so high she couldn't relax. So we started using these acupressure points on her, and a lot of points are around the neck, which is nice that we can, when we're doing manual therapy, we can use those points. And I think that's the beauty of us using acupressure because we are musculoskeletal specialists and we are so hands on with our patients. So if we know exactly where the points are, we can work on those points as we're working on, other things as well. If you're, stretching a muscle, doing range of motion, or just working on fascia. So this is all, fascia and connective tissue, and that's the premise of what the evidence is showing us, that where these points are. We also talk about perineal acupressure. We talk about vaginal acupressure. So there are a lot of things that we can do for pelvic health patients in particular, but this is applicable to even our orthopedic patients.
Wonderful. Well, you've got such a lovely combination of passion and knowledge for this topic, which always makes for a fantastic instructor. And again, we've had wonderful feedback about the course as well. So I know that folks will enjoy adding this tool to their toolbox when they take your course.
Absolutely. Thank you so much. And I look forward to teaching this course for a long time to come and very happy to share this knowledge and very happy to teach for Herman Wallace. Thank you for having me.
Thank you.